Republicans in the Senate have less than 2 weeks to pass a bill that would repeal and replace Obamacare.
That's right, but even with that tight deadline, some lawmakers, including Kansas Senator Jerry Moran, haven't decided how they'll vote. KSNT News reporter James Ryan caught up with Senator Moran earlier today to find out if he's any closer to making a decision.
Republican senators have until September 30th to pass a bill that repeals and replaces the Affordable Care Act without the help of Senate Democrats.
The Cassidy bill is a real good step in the right direction because it returns the decision-making back to the states.
Still, Senator Jerry Moran says he isn't completely sold on the proposal.
The issue is, how do we thread the needle? The Affordable Care Act created coverage for people with pre-existing conditions. I want to see that continue.
But Democrats in the Senate say the bill could jeopardize how people with pre-existing conditions get coverage.
There's no question that the costs can go up substantially.
Moran says he's waiting to see what the bill says, but he points out that many people are seeing healthcare costs go up as we speak.
Kansans have been certainly knocking on my door telling me about how expensive healthcare is, how unaffordable it is, how co-payments, deductibles, and premiums are something that they, their family, or a business that they own can't afford.
And it's an opinion some in Topeka agree with.
A lot of people do use Obamacare, but personally I think it affected a lot of the middle class and upper class that people didn't often realize were affected by Obamacare.
Abby Troutman is a freshman majoring in pre-med at Washburn University. She says she'd like to see more money flow back to doctors.
Because a lot of times the money does go back to insurance companies.
Troutman agrees with Moran that people with pre-existing conditions should be protected. But how to do that? She says she'll leave that up to the professionals. In Topeka, James Ryan, KSNT News.
All right, thanks James Ryan for that report. If the bill is passed, it will impact states differently.
That's right. Those states that it will impact include Kansas, Mississippi, Texas, Georgia, South Dakota, and Tennessee, and they are likely to see the biggest boost in federal funding. Kansas would see a 61% increase.